Good morning, everyone. We're just going to go ahead and get started. A lot of people are still out registering, but we're just going to get started to keep the day on schedule. So at this time, we invite you to join us in honoring our nation. Please rise for the presentation of the colors by the Hillside High School ROTC Color Guard, and remain standing for America the Beautiful.
Beautiful, for heroes proved in liberating strife. Who more than self their country loved, and mercy more than life. America, America, make God thy gold refined, till all success be nobleness, and every gain divine. And you know, when I was in school, we used to sing it something like this. Listen here. Oh, beautiful, far spacious skies, far amber waves of grain, far purple mountain majesties, above the fruited plain. But now wait a minute, I'm talking about America, sweet America. You know, God done shed his grace on thee. He crowned thy good. Yes, he did. Heavy brotherhood from sea to shining sea. You know, I wish I had somebody to help me sing this.
Thank you for standing. We extend our appreciation to the Hillside High School ROTC Color Guard for their presentation. It's nice to have the young people, right? And now it's my pleasure to welcome each of you to this 2026 Women's Health Awareness Conference. And as we've just taken a moment to honor our nation, we are reminded of the shared responsibility that we all carry to serve, to uplift, and to strengthen our communities. And that is the work of the Women's Health Awareness Conference: serving, uplifting, and strengthening the health of women and families in our communities. I'm Joan Packenham, founder of the Women's Health Awareness Conference and chair of its steering committee. It's truly an honor to stand before you today and to be a part of this very important work. But before we get started, we're going to have our soror to come over and tell us what we do in case of an emergency.
Good morning, everybody. My name is Gerald Anderson. I'm a proud member of the Durham Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and this is your safety briefing. So, if there was an emergency and you were in this room or any room today as you navigate throughout the building, please come into the space and be aware of how to get out of the space. So for this room, for example, to my right and to your left, there is an exit sign. You would go that way. To my left and to your right, same thing. Be conscious of the fact that sometimes the closest exit in a space may be the one behind you. In the event of a fire, do not, by any circumstances, get on an elevator, find the nearest stairwell, and safely navigate your way down. If you have a disability and need assistance, we would ask that you shelter in place until someone is able to assist you. All right? So I always say to my sorority, and I'll say to you this morning, safety first. Have a great day, and thank you for being here.
Thank you. Thank you. Safety first, safety first. Know your exits. So at this time, we're going to do what we traditionally do, right? And for me, tradition is very important. So before we go further, we're going to do our Let's Move segment. Since our very first conference in 2015, we start our day by releasing our stress, letting our hair down, and getting energized together with our Let's Move segment. We're very fortunate to have with us again Willa Robinson Allen, who has been a long-term 12-year member of the steering committee, to lead us once again. So I'm going to ask everyone to rise. Yes, everyone. Everyone. And remember, we're not looking for perfection, just participation, okay? So do what you can, but get ready to move. All right, Willa.
All right, they messed up. They gave me a microphone. All right, so this has been a year or a couple years. A lot of things been going on that maybe it's gotten us down and made us feel like we haven't had, that the future may be in trouble. Or, yeah, I heard bleak out there. So I chose this song for that purpose. Sing along with it. Have a good time. We're going to move.
Now, I can't do that one, Willa.
It's been far too long. It's been far too long, y'all.
Right.
Just doing me while I get along. Believing the negative people way behind. 'Cause it ain't no.
Huh? Okay. Thank you very much. That was 5 minutes. That was 5 minutes. So are you all energized at this time? Did you stretch it out? Did you let your hair down? All right, now we ready to get started. So I'm going to ask the panel to please come up, the welcome and greeting panel. All right. So we want to thank Willa because that was really energizing. And then thank yourselves for getting up and participating. Yes. Yes, what a great way to start a day. I feel relaxed already. I was feeling a little tense, but that shoulder movement, she got it out of it. So I think I would miss an important opportunity if I didn't take this moment to thank all of you for your support, for your commitment, and for helping bring this conference together. I'll be honest, this year has been challenging, but what I've seen, what this community has done to make sure this conference happened has been nothing short of incredible. An observation when I walked in last night, a little late, yes, a little late, my heart skipped a beat. To see so many people with such energy, the young at heart, and from every corner of our community, coming together, working side by side, late at night, united by a shared vision. Now that was powerful. It was very powerful. Y'all, the building was buzzing last night to prepare for all of you today. And let me tell you, that just doesn't happen, right? It takes commitment, it takes care, and it takes community. And in that moment, I was sort of reminded, you know, that we all have moments, right, when coming together means a little more. Moments when it's not just a date on our calendar, but something a little bit deeper, something that reflects who we are, what we care about, and why this work matters. And for me, this was one of those moments when I walked in last night. For 12 years, this conference has been about community. It's been about showing up for one another, about sharing knowledge, and pushing forward the health and well-being of our women and families. But what matters most is that we are here together, still showing up, still doing the work after 12 years. Because, yes, thank you. Because women's health, family health, and community health are not just topics, right? They're personal to us all. And it's that shared commitment that brings us here today and that makes this work possible. So at this time, we're honored to hear greetings from a few of the organizations whose partnership and support help make this conference possible. Since our very first conference in 2015, well, got the wrong thing. And while it takes community, let me just say, while it takes community, it also takes strong leadership and partnership to sustain such a movement and such work moving forward. This work, in part, has been led by the National Institute of Environmental Health Sciences, whose commitment to advancing women's health continues to move this conference forward, and more importantly, to improve the health and well-being of women in our communities. We are deeply grateful for the strong collaborative partnerships that have been with us since the beginning and continue to sustain and strengthen this conference. We proudly recognize our co-sponsors, North Carolina Central University and the Durham Alumni Chapter of Delta Sigma Theta Sorority Incorporated. We also acknowledge the continued support of the City and County of Durham, whose partnership is essential to advancing this work in our community. At this time, we will have greetings from the National Institute of Environmental Health Sciences, our co-sponsors, and our city and county representatives. It is my pleasure this morning to introduce Dr. Kyle Walsh, the new director of the National Institute of Environmental Health Sciences and the National Toxicology program. And this morning I was listening to your conversation, just butting in just a little bit. And you said this marks your 6th month at NIEHS. So welcome to the podium, our new director for the NIEHS, Dr. Kyle Walsh.
Good morning, everyone. I appreciated Joan's words, but also that gave me about 4 minutes to catch my breath after our little dance party. Me being out of breath giving opening remarks would be suboptimal. Although I will note that these days, most of the dancing that I do is at weddings, and so dancing in a suit felt right at home for me, and I was really happy to participate. So I just wanted to briefly introduce myself. I'm Kyle, and I'm the director at the National Institute of Environmental Health Sciences. We are one of the 27 institutes and centers at NIH. And folks don't know this, but in general, but in this community perhaps they do. 26 of those institutes and centers are located in the DC metro area, and we are the only one not located there. We're in Research Triangle Park and here in Durham, and so it's a fantastic place to be, and we love to be able to work with the community here in Durham and in Orange and the rest of the area. I wanted to sort of give an example of something, and then maybe I can tie it in here. So about, 4 years ago, there was a train derailment in Ohio, and this was in the town of East Palestine, okay? And so the train derailed, and after 2 days, they became very concerned that it was going to catch fire and explode, and so they did a controlled burn. You may have seen this in the news, or maybe not. That train derailment led to the burning of hundreds of thousands of gallons of chemicals. This was a train not carrying coal, not carrying wheat or barley. It was carrying vinyl chloride and other chemicals, right? And so that community became very concerned about what the environmental health effects would be in their town and in the surrounding region. And so NIEHS was able to help respond to that, and a few months ago we went out there and launched a $10 million 5-year program to work with that community, do community engagement, to fund universities, University of Kentucky, University of Pittsburgh, and others, to have sort of boots on the ground and really be engaged, right, with the community and help identify what the most pressing health concerns were and to do the type of tracking that would give signals if there were outbreaks of particular illnesses. Now, I bring this up because I think it does not require a disaster like a train derailment and a burn to create scenarios where communities need engagement from federal partners, from government partners, from academic partners to approach environmental health and One Health, right? And so it doesn't require a disaster to do that, and it absolutely should not require a disaster for government and academic partners to meet community members where they are, and that's why I'm so glad we're able to do this today, okay? Now, I just sort of wanted to wrap by saying one thing, which is that, this takes a great deal of collaboration and organization and coordination. I think that others will give many, many thanks. Hopefully, Joan will take care of a lot of that. In case she's the one in charge of doing that, I would like to thank Joan specifically. And the one other group that I'd like to call out, because before this, I was faculty at UCSF and then Duke for the last 8 years, is the student volunteers. I really want to thank all of the student volunteers who are here today, spending their time with us. Hopefully they'll learn something. Hopefully we'll learn a lot from them. And so those volunteers from Duke and UNC, NCCU, NCA&T, Durham Tech, as well as at our own program at NIEHS, it's just fantastic, and we're so thrilled that you're able to help and willing to help, and just excited to have you all here. So I'm looking forward to a great day, and thank you all so much this morning.
Thank you, Dr. Walsh. Our next speaker is Angelique Stallings. Is Angelique here? Not yet. So North Carolina Central, so I'm gonna ask Dr. Ramaki, can you come up here with me to represent North Carolina Central? I'm not gonna ask you to speak. I just want you to see one of the great partners that we have at North Carolina Central. So North Carolina Central said yes. Yes. No, stay here. North Carolina Central said yes from day one. I went to the School of Public Health, and Dr. Laverne Reed said, oh yeah, we can do this, we can help with this. And they've been here. And so, NCCU's motto, what's NCCU motto for NCCU grads? Truth and service. And they have been true to their word. And so I thank NCCU for this continued partnership. I met with the chancellor just 2 weeks ago, and she confirmed the continued partnership, so it's sustainable. She just couldn't be with us today. So thank you so much, Dr. Ramaki, for standing in place. And by the way, the chancellor's name is Dr. Carrie Dixon, North Carolina Central University chancellor. So at this time, I'm gonna have Durham Alumni Chapter of Delta Sigma Theta president to come up, but Durham Alumni Chapter of Delta Sigma Theta Incorporated has been in the Durham community serving who? You. Since when? 1931. So they are the perfect community partner, and they're guided by the foundational pillars of sisterhood, scholarship, and service with the programmatic thrust of physical and mental health. They've been with us since day one. When I went to the president, Arvis, and said, have this idea. She said, of course, I got you. Durham Alumni has your back. So they've been here helping, collaborating, working with the community to understand the community needs so that we can come in the community and fulfill those health needs where we see. And so at this time, we're honored to have our chapter president, Soror Sonji Samuel. Come forward, Sonji.
Good morning, and welcome to the 12th Annual Women's Health Awareness Conference, the leading women's wellness conference in North Carolina, leading and premier women's wellness conference. As my soror Joan Peckinham said, I am Sonji Samuel, president of the Durham Alumni Chapter of Delta Sigma Theta, and I bring you greetings on behalf of the over 445 members of our chapter. The Durham Alumni Chapter is a proud co-sponsor of this amazing conference and has been since its inception. Our partnership enhances, supports, and furthers the physical and mental health programmatic thrust of Delta Sigma Theta Sorority Incorporated. This year's theme is Transforming Communities by Enhancing Women's Health. We are proud to contribute to advance, to educate, and inform women in all areas that can help them and will help them to improve their health, physical health, mental health, and overall well-being. With health education, information, and resources that have been available since this program started in 2015. The conference began as an attempt to reach underinsured women and has been successful in reaching over 6,000 women from 55 counties in North Carolina and other states. I would like to acknowledge Dr. Joan Packenham, who is the chair of the steering committee and the visionary for offering this amazing offering provided to women. I'd also like to acknowledge the National Institute of Environmental and Health Sciences for all of their hard work and contributions to make this a successful event for the past 12 years. Special thank you to all of our panelists, presenters, volunteers, who were all willing to offer their time, wisdom, expertise, and knowledge that will provide impact and information that we can all use. Finally, thank you to all of you for attending. We hope that everything that you receive today you can use to improve your health and the health of your family. Thank you once again, and enjoy. At this time, I will bring greetings from our South Atlantic Regional Director of Delta Sigma Theta Sorority, Soror Pamela Murphy Lewis, who is unable to be with us this morning, but has sent her words. On behalf of the South Atlantic region, it is with great pride and admiration that I extend heartfelt congratulations to the Durham Alumni Chapter of Delta Sigma Theta on your 12th Annual Women's Health Awareness Day. Through your collaboration with the National Institute of Environmental Health Sciences Clinical Research Branch, Office of Human Research and Community Engagement, and North Carolina Central University's Department of Public Health Education, the chapter continues to mark a significant milestone. Celebrating under the theme, Women's Health Awareness 2026, Transforming Communities by Enhancing Women's Health, this free wellness conference is dedicated to educating and empowering women. Through comprehensive health education and access to critical health information and resources, and on-site health screenings with medical follow-up, this initiative addresses both immediate and long-term health needs. Additionally, the inclusion of environmental health awareness reflects a holistic approach to wellness that is both timely and necessary. The measurable impact of this initiative is truly commendable. Since 2015, this event has reached over 6,000 women across 55 North Carolina counties and 41 states nationwide. These efforts not only increase awareness of health conditions affecting women, but also actively reduce barriers to care, promote early detection, and ultimately save lives. The ripple effect of this work extends far beyond a single day, strengthening families, communities, and future generations. Thank you for your continued dedication, vision, and excellence in advancing women's health. Your work stands as a shining example of impactful service and meaningful community engagement. With sincere appreciation and commendation, Soror Pamela Murphy Lewis, Regional Director, South Atlantic Region, Delta Sigma Theta Sorority Incorporated. Thank you.
Thank you very much, Soror President. At this time, we have to thank our city for the wonderful work that the city does. You know what our motto is for Durham? Durham is the city of medicine. Did everybody forget? Durham is the city of medicine. And today we have with us Mayor Pro Tem Cavallera Javiera. I hope I said that correctly. I may not have. But, and she will bring us greetings on behalf of the mayor and the city of Durham. Thank you so much. I'm gonna ask you, did I say that correctly? Let me say that correctly. Yeah, Javiera Caviera. Thank you.
Good morning, everyone. Thank you so much for being here in this. You could choose many things to do with your time on a Saturday morning, and you've chosen to be here, which is important. It shows what you value. It shows what you value for your community. I bring you greetings on behalf of Mayor Leonardo Williams and my colleagues at the Durham City Council. Again, my name is Javiera Caballero, and those are actually 2 of my 5 names. My full legal name is Alejandra Javiera del Pilar Caballero Sanchez. And I serve as the Mayor Pro Tem for the City of Durham. It's truly my honor on behalf of the entire Durham City Council to welcome you to the 2026 Women's Health Awareness Conference. I want to begin by expressing my appreciation to Dr. Joan Pakenham, the founder and chair of this program, and to her team at the National Institute of Environmental Health Services, part of the National Institute of Health. Thank you so much. We are really honored that Durham consistently holds this conference. Again, it speaks to our values and what matters to us as a community. Thank you for inviting me to bring greetings this morning, and thank you for the incredible work you do in our community year after year. So I'm a mom of 3 kids, and as someone who has spent many years working with families in public schools, I know just how often women put ourselves last. We take care of our children, we take care of our parents, our partners, and our neighbors. And by the time we get through all of that, our own health often ends up at the very bottom of the list. I've done it myself more times than I can count. And as someone who grew up in an immigrant family, I understand how confusing and overwhelming navigating the health system can be, especially when language or resources are barriers. That's why this conference is so important. For the last 12 years, the Women's Health Awareness Program has been a lifeline for women across Durham and the Triangle, especially women who are under-resourced, underreported, and understudied. More than 6,000 women have participated in this program, receiving support, information, and screenings that can truly change lives. This conference offers more than 400 educational sessions tailored to what women say they need. It provides free screenings, from mammograms and cancer screenings to diabetes and kidney checks, to vision, dental, hearing, cardiovascular, mental health, and pulmonary screenings. And what makes this event so powerful is that women are not just screened, they are connected to ongoing primary care if they need it. You'll also find more than 200 exhibitors here today, each offering practical tools, services, and resources to help you stay healthy. This program's goals reach far beyond today. They focus on improving health literacy, reducing disparities, and addressing environmental factors that shape women's health. These are issues I deeply care about on my work on the City Council, especially environmental justice and making sure every resident has access to information in the language they speak and understand. As Durham's first Latina council member, it matters deeply to me that every woman in our community feels seen, supported, and valued. And standing here today, I see a room full of women who hold our families, our communities, and our city together. I also want to recognize the partners who make this event possible: the National Institute of Environmental Health Sciences, the Durham Alumni Chapter of Delta Sigma Theta Sorority, Inc., and North Carolina Central University's Department of Public Health. Thank you so much. And just briefly, I'm going to go off script here for a minute because I think about the work that the city and county have done. We know the moment that we're facing. We know what our communities are facing and how they're being targeted. And I just want to say, especially for those of you who are Durham residents who live here, we are not going to get through the next several years of challenges. Somebody said earlier, feeling the bleakness without one another, without standing in solidarity for all of our neighbors, and without really knowing that we aren't going to get through it without each other. And so as you're moving through today, please know that your Durham City Council will always support you. We will always fight for what is right. We will always stand up for all of our neighbors, regardless of what is happening at the federal and state government level. Thank you.
Thank you. Last but not least, Durham County Department of Public Health. What can I say about the Durham County Department of Public Health? In 2015, when I went to the Durham County Department of Public Health, Gail Harris said yes. This is what Durham needs. And the Durham County Department of Public Health has been there for women's health awareness, providing resources and services for the residents of Durham and beyond Durham. So I want to say thank you to Dr. Jenkins. When he came after Gail retired, I think we were at the retirement. Were we at the retirement? I went to the retirement party. You know, we like to party. So we went to the retirement party, and Gail told him about women's health awareness, and he said, "We got it." And so they have. And so today, throughout the screenings and the different booths, you will see Durham County Department of Public Health. They have been on the steering and planning committee, helping us to plan. We have to understand your needs, right? We just can't come into the community with our own thoughts, right? We have to understand the needs of the community in order to do the science that we need to do to be able to help the community to thrive and survive. So the Durham County Department of Public Health has played an important role in helping us to understand the residents in Durham and beyond. So at this time, Dr. Jenkins, will you come forward, please, and bring us the greeting on behalf of the Durham County Department of Public Health?
Good morning, everyone. It is truly an honor to welcome you to the Women's Health Awareness Conference here at Hillside High School in Durham, the City of Medicine. Thank you for being here, for showing up with purpose. Before anything else, we pause to recognize the foundation of today. We stand here because of women, past, present, and future. The women who pushed forward when the path wasn't clear. The women leading, building, and holding things together today. And the young girls who are watching and preparing to lead tomorrow. Women's health is not just about care. It's about legacy, strength, and possibility. As a man, a proud member of Phi Beta Sigma Fraternity Incorporated, whose motto is culture for service and service for humanity. As a health director, but also as a son, a brother, a proud husband of a member of Delta Sigma Theta Sorority Incorporated. And as a father, I want to be crystal clear. Women's health is not just a women's issue. It is a shared responsibility because our lives are connected. You can go ahead and clap. We are raised by women. We stand beside women, and we are shaped by women. When women are healthy, families are stronger. When women are supported, communities thrive. And when women are empowered, every single one of us benefits. Today's theme, transforming communities by enhancing women's health, is more than just a statement. It is a strategy. Because improving women's health doesn't just change individual lives, it changes systems, communities, and futures. In my role as public health director, I look at a lot of data. But here's what I've learned, ladies and gentlemen. Today brings both of those together. Data tells us where the challenges are. People tell us what matters most. So this is not just a conference. It's an opportunity to act. Screenings that identify risk early. Education that informs better decisions. Wellness practices that support long-term health. Connections that extend beyond today. This is what real impact looks like and has looked like for how many years, Joe? 12 years. Simply stated, this impact is practical, personal, but most importantly, it is powerful. As you move through the day, I want you to keep 3 things in mind. Learn something new, apply what you learn, share it with someone else. Because information only becomes powerful when it moves beyond this room and beyond Hillside High School. So thank you to the National Institute of Environmental Health Sciences. Thank you to our many partners and every single volunteer that made today possible. And thank you to each one of you for being here today, and I'll leave you with this. What you learned today could save your life and the lives of the people that you love. So let's honor the women that came before us, support the women beside us, invest in the women who will lead us in the future. Welcome to the Women's Health Awareness Conference 2026. Let's make today count. Thank you very much.
Thank you, Dr. Jenkins. So, I wanted to let you know the ways to access the conference information. You all received a paper program book, but we also have an electronic program book on our website. We have an agenda at a glance, so if you get a little lost in the agenda, you go pull out that agenda in a glance. We have conference exhibitors and speaker pictures and bios on the website. So if you need to know someone's bio or see the picture, please go to the website. Trying to save funding, not to put everything in the program book, but have it up on the website. So those of you who have your cell phones today, please use your phones to get more information. Also, it's important for us to note that for those who could not be with us in attendance today, we have virtual live streaming. You know that Women's Health Awareness have our satellite sites, right? In Asheville, North Carolina, and Granville, North Carolina, and Pitt County, we have various satellite sites where extends to those sites for our rural communities. And so today we decided, we heard them. So we reached out to them and said, come to Durham. And they said, do you know what the price of gas is? So then we decided, okay, we're just gonna live stream. So there are many sessions today that you will go to where it's being live streamed. So don't forget that. And please welcome our guests who are coming in through virtual means. So immediately after the conference, we will send out our evaluations. And every year I'll say this. I always say, how many of you all know free is not free? Okay, you do this for free, right? So we need information from you so that we can take the information that we glean from you in the sessions as well as the overall evaluation to seek funding that we need to put this program on. So please, you will receive an email for the overall evaluation after today's conference. So please don't forget us and go in and evaluate the conference for today. And for attending the conference and completing the evaluation, you will receive educational contact credit hours for your participation. And you will also be entered into a raffle drawing. So you may be lucky to get that $25 gift card. So always, the worker bees never get recognized, right? Because everybody waits to the end of the program to thank them, right? So I want to thank everybody at the beginning of the program so that everyone is recognized. Are there any steering committee members in here? Are they all out working? Any of the steering committee? I see a few hands go up. So I want to thank the steering committee because without them, we could not have this. They worked very hard to pull this together. And the steering committee consists of all of our partners. We have a lot of partners. We have over 100 partners to help with this program. You know, academic partners, community partners, hospital organizations, corporate partners. So we have a lot of partners, and they're represented on the steering committee in various ways. Again, it's to understand the needs of our community. So thank you so much for the hard work that we have done this year and all of the years since 2015 to put on Women's Health Awareness. Lastly, I too have 3 things that I want to say. I want to say enjoy your day, but step into your own power, right? Because knowledge is what? Powerful, right? Knowledge is power. So I ask you to connect, learn, inspire, and be inspired. So enjoy your day, and thank you for coming. We will have the keynote address in here, and you don't want to miss this keynote address. We have some fantastic speakers who are going to be talking about the journey. And that is the journey that we are taking, whether it's our adolescent years, our reproductive years, perimenopausal years, menopausal years, or post-menopausal years. We have a wonderful, distinguished panel that will be here to talk about it all. So come back for the keynote session, and then after the keynote session, the exhibitor booths and the screening rooms will open. So thank you. I hope that you all have a snack waiting on you when you come out along the hallway. Somewhere out there, they're putting up the snack tables. So come back in at 9:50 to be able to participate in the keynote panel. Thank you so much for coming to the opening. We greatly appreciate it. Oh, one more thing. If you have not checked in, for those who have pre-registered, if you have not checked in, please check in. And for those of you who have not registered, please go ahead and register at this time. Thank you so much.